A year is a year, right? Well, maybe not in healthcare. So what is it? Why should you care? And some tips to help you along. Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. So what is the difference first between a calendar versus a business year in healthcare? Business day is a day that is not a weekend or a legal holiday. Most weeks will therefore have only 5 days in healthcare. But a calendar day is every consecutive day that includes weekends or legal holidays. In this case, a calendar week would have 7 days. A calendar year is 365 days from the time the policy becomes active or renews. It usually starts on the first day of the month, and it usually or often starts on January the 1st, but not necessarily. If you get a new insurance plan through a new employer, your policy starting, let's say, August 1st, would then start a year at that time. Whether it then renews on January 1st would depend on your employer's plan. If you are eligible for a qualifying event, for example, you turn 26 and can get your own insurance, or have gotten married and now qualify to join your spouse's health plan, that year would again start at that time and may or may not continue for a full 365 days or start again on January 1st or whenever the employer decides. And some plans, especially unions, may start on the 1st of July or the 1st of October, the beginning of a quarter. Again, it depends. It's healthcare, therefore anything goes. What is important to know about that year is, first, the share of cost or out of pocket. It is the set amount per policy that you must pay out of pocket before or during the time your insurance pays for covered expenses, but before your insurance covers everything at 100%. And by everything, I mean the allowance. So that share of cost or out-of-pocket max is the sum of the deductible, the co-insurance, and co-payments. Deductible is the amount you pay first before the insurance pays anything. Co-insurance is the percentage you pay afterwards, 80-20 or 60-40. Co-payments is the set amount you pay whenever you go into a doctor's office or may visit an ER, for example. There is a maximum individual and a maximum for family. It's healthcare, it's got to be complicated, right? Of note, should you switch insurance plan in the middle of a year, your met deductible or out-of-pocket is not transferable from one plan to another. And yes, it resets with every policy, unfortunately. Now, knowing when your year starts and ends is important also for preventive care services. Why? Because, yes, they are free, but you may have a number of same preventive services limited per year. For example, only one well-care physical exam, only one detection scan, for example, a mammogram, or some form of a procedure like a colonoscopy. So if your policy renews or started on January the 1st and you have a physical exam on March the 1st, don't have another one on October 15. That second one will not be free. There might also be limitation per year. You usually can only get 12 refills of the prescriptions per year. And to take the example of a dental plan, only 2 free cleanings per year. And some visits or services such as chiropractic, acupuncture, speech therapy, occupational therapy, home health services can also be limited per year, but by number, 100 visits or 30 visits. Anything beyond that maximum per year, even if only 1 month or 1 quarter have passed, will be either denied or processed but placed under your financial responsibility. Do I have tips? Of course. The first one, keep track. By this I mean of your deductible, of your co-insurance, of your overall out-of-pocket or share of cost. Why? Because if you don't use it, you will lose it. For example, get all your refills or get your preventive care visits, services, tests, scans, etc. done before the end of that year. They will be free. If your out-of-pocket maximum has been met for the whole year, either as an individual or as a family, make up any follow-up appointments that were recommended, any consultation, service, intervention, procedure, even an elective surgery if needs be. Again, if your maximum has been met, especially for in-network providers, then you would not have any liability. If you do need more than 20 physical therapy sessions for the rest of the year, or if your autistic child needs more ABA therapy than the 25 allowed per the policy, do apply for an extension. It should be based on the medical necessity, meaning that you or your family member recovering or maintaining a certain level of help requires additional sessions, visits, etc. And especially if what is called the US standard of care, meaning what the general medical profession agrees or recommends as being the standard or fairest, best course of treatment, and that is not met under the terms of the policy, you can definitely apply for an extension of that benefit. Any special circumstance, for example, your child is autistic and needs more ABA therapy, or you broke both legs during that ski incident and therefore need double the amount of physical therapy sessions. With good medical records, a letter from your doctor explaining why you need more sessions, more visits, more treatments, success should be on the horizon. But regardless of when your benefit year starts, just make sure you take the best advantage of it, especially when a number of services are free to you. I thank you for watching and for your likes, comments, and subscribes.